Health Unit, and Dr. Kemisha Shaw-Kelly, Program Development Officer, both from the Ministry of Health and Wellness, to explain what's new. Good morning, ladies.
Morning to you both.
Good morning.
Thanks for having us.
All is well?
All is well.
Dr. Roporter, let me start with you. What is that? What is the passport for go foreign, or what kind of passport we're talking about?
No, this one is an important document, but not to go foreign. Here it is. It's a handheld book that is issued to all newborns at birth in a hospital or wherever they're born. And it was introduced in September 2010, so it's been around for a while, but we've updated it recently so that every newborn as of July 1 gets that updated passport. And what it is, it's a tool that has all the child's information on growth and development, because it's critical to have all the information present, not just for health checks, but for school visits, immunization card, information on nutrition, breastfeeding, dental checks, and so much more.
Good. Is it machine readable?
No, it's not. It's not like the passport you take to the airport.
No, I was just wondering because, I mean, I'm sure all the data is going to be stored somewhere. So
Sure.
if it is machine readable, then that probably just makes it a little easier.
And that's the plan. We've always wanted to digitize it,
Right.
but we updated it, and it's a journey that we're
And
on.
what does that mean when you say you updated it? Updated it from where? So what obtained before the update?
Okay, so in 2010, September 2010, we had moved from the immunization card, which was just this one blue card which was given to persons. And then we had the Child Health and Development Passport, which, as Dr. Roporter stated, had information about both the immunization, it had nutrition, something on the dental checkups, as well as tips for parents. And a study was done in 2018 which showed the need to update. So in it we have, as you're seeing now, more vibrant color. It also includes early stimulation tips, which weren't in the one before. The immunization schedule was updated, and it's also included in the passport.
Sure.
So
I guess this is almost a tell-all for parents,
Yes.
which is what you wanted.
Definitely. Parents must be informed, the healthcare worker must be informed, the educational institutions, so those at the nurseries and daycares and primary, secondary school, it goes with the child from birth to 18 years. So it travels with the child everywhere they go, to every health check and every school.
What happens if you lose it?
Well, we can replace it with another version, but it's important not to lose it.
Right.
And so just like your passport that you need to travel with, you have to keep it as a very important document. You keep it safe and protected. Try not to lose it, because it has so much information, and to replace it, it's very difficult.
Yeah, I quite like it. It was on the easel just now, but you don't get an opportunity to see what's on the inside. So, for example, it opens with photos of place for you to place your photos of your child at different phases and stages of their development. There's a full table of contents over on this side, which takes you through a wide, making it twisted there, takes you through a wide range of developmental milestones to look out for. I do assume as well that because of this, once you're completing this document, it helps you to be that much closer to your child, and for your child to understand more about themselves and their family. Because I even see in here we have something for like allergies and you know different people in your family and what their health situation is like. Yeah.
And it also has screening questions for parents, because if the parents are not well, then it's going to affect the child. So at each visit, there are questions for the child that the health worker will go through, and there are questions for the parent. Are you well? Are there problems at home that are affecting the child? So that it will equip our health workers to intervene as necessary and do the relevant assessment and referral.
How often should a parent and their child or children visit the health facility with the passport to do the updates? Is that a part of what is in the instructions here, or there's a recommendation from you?
Definitely, there's a schedule. So we follow the immunization schedule, but in addition to that, there are specific health checks, and they're outlined in the passport. So every couple of months, so for infancy, there are at least 4 visits that need to happen. And then when they're 1, there are about 2 to 3 visits that happen as well.
Dr. Shaw-Kelly, what happens to someone who had the previous one? Can they come in and switch, or is this just for newborns, or I can come in and say, well, I did get mine 5 years ago, now you update it, I can get that.
Okay, so they will keep the one that they have.
Yeah.
So just like before with the immunization card, so I had an immunization card and I would keep it. So just the same for those from September 2010 to July.
So
They would have kept what they have.
those will not get the updated
No.
one.
So
Can it be bought?
No. So it would be just for persons, this updated, born since July 1st of this year.
Oh.
And it's free of cost. We can't
Yeah, but what
charge
about-
for it at all.
Not to belabor the point, I hear your answer, but what if there are things in there that the book that I have or the passport don't have?
Okay. So it would be documented when they go, for example, to the health center.
Okay.
in the
And
hospital.
obviously when you're going to the doctor, you need to carry it and say,
Right.
doctor, say,
Sure.
following instructions and...
Sure. So all the information is in the health record at the health facilities. The passport makes it easy and transferable between health centers. So it's not that the information is lost forever. It's a convenient way to store critical information along the child's journey. So it can be, we try to minimize replacements, right? So that's why it's important for them to keep it safe. But the information can be populated again if that is the case. But we don't do that as a routine to say, as soon as you lose it, we can replace it. It's very important to keep it safe
not to
and
lose it.
secure.
Yeah, yeah. I guess it's the same thing like your regular passport.
Definitely.
You don't want to lose
It's
that.
quite a hassle.
There's a process that we have to go through as well to investigate the loss.
And you say
etc.
effective July 1, so we're 8 days plus in, because today is July 9, right? All newborns going forward at all health facilities, and you say wherever the child is born. So let's say you do a home birth with a midwife, right? And you take the child to get them registered. At that point of registration, they would receive this, yes?
And the midwives would have in the package for their home delivery kits. So upon delivery, the passport would be.
Well, look over it from every angle, man.
Not that it matters, but is this what they call best practices? Are other countries use this? Are we behind, or is we start it, or what?
Well, other countries are looking on at Jamaica and saying, hey, we want to do that too.
So as we started?
Yeah, we started it. And it's something that we've been telling the international community about, and they've been looking on. It's been useful as well. It has been very helpful. The private sector is on board, public sector, because it really does optimize the child's growth. And
Tell me again about what you said about parents, because you said if parents are ill or something like that. So what is in there specifically to the
For the
parents?
parents, it has the tips for parents as the child grows. So there's the nutritional tips, safety tips, early stimulation. So if you look also, you'll see
How
where
long
it's
you must
colorful.
breastfeed and all
Yes,
kind of stuff.
breastfeeding is also there. And there's a section, if you look, it's coded. At the top, you'll see with the pencil, and it would state that for the parents to complete.
Right.
There's a section where you have the stethoscope for the healthcare workers to complete, and then there's a section with the smiley face with a graduation cap for the educators to complete.
Yeah, man.
So, yes, we try to make it user-friendly. Yes.
All right, yeah. I think I skipped past that particular page, but if you zoom in on this page, you'll see where it says medical history and so on, stuff like that. So
Yes.
you're completing. Oops, one. Keep on turning the thing the wrong way. You'll see where you can complete information about allergies and former, like your parents' health situation and that kind of thing. Because, for example, things like diabetes and hypertension can be passed on genetically, or you can be predisposed based on the situation of the parents. So, yeah, this is pretty good stuff. I wish I had this back in the 80s.
And every time they get weighed and measured,
Right.
it's recorded, and we can check if they're obese and if they're putting on more weight for their height and all of that, and to intervene before
Excellent.
problems start.
Thanks for coming in. God bless you both.
Thank you so much
Thanks
for
For
having
your
us.
service. Can't do without you. Dr. Julia Rowe Porter, Director of the Family Health Unit, and Dr. Kamisha Shaw Kelly, Program Development Officer, both from the Ministry of Health and Wellness. Off the shelf, Garth will have that when we come back. Stay with us, please. Soon come.